Dr. McKinnon, your educational literature states that dizziness and imbalance are most often associated with disorders of the inner ear in the minds of your patients and their caregivers and doctors. But is there a risk in assuming that the source of dizziness is related only to inner ear problems?
Well, more often than not, the source of the dizziness is the inner ear. There are many other conditions that can give a patient the perception of dizziness. My colleagues, cardiologists, neurologists, nephrologists, endocrinologists, internal medicine specialists, all encounter disorders that have symptom of dizziness associated with them. And many of these disorders will actually work in concert together to give the patient the symptoms of dizziness. In addition to that, oral surgeons and dentists have reported that TMJ can have associated with it the symptom of dizziness. Last, we take lots of medications, and many of those medications can contribute to the symptom, the perception of dizziness. Regardless of the cause of the dizziness, it should be evaluated, and it may require multiple specialists to evaluate and clarify what's going on. The inner ear is very sensitive in detecting movement. However, when it is disabled or injured, that loss of information gives the patient a perception of imbalance. Now, that loss of information may be due to something in the inner ear, or maybe due to something outside the inner ear that other specialists will need to identify.
How can someone find out if the dizziness they are experiencing is related to the inner ear?
Patients who have symptoms that do not respond to routine treatment they receive should consider an evaluation appointment with me to help identify what could be going on. Dizziness can be debilitating, and we want to help our patients get their lives back, and very often we can help.